Welcome to the Close the Chapter podcast. I am Kristen Boyce, a licensed marriage and family therapist with a private practice, Pathways to Healing Counseling. Through conversations, education, strategies, and shared stories, we will be closing the chapter on all the thoughts, feelings, people, and circumstances that don't serve you anymore and open the door to possibilities and the real you. You won't want to miss an episode, so be sure to subscribe. Welcome to this week's Close the Chapter podcast. I am so grateful you're joining me, especially for this conversation around psychiatry and mental health and things that I haven't really spent a whole lot of time digging into in terms of psychiatry. That's why I love having new guests on the show. So Dr. Fred Moss is a renowned mental health advocate, keynote speaker, and psychiatrist with a passion for helping people find their authentic selves. We love that because that's what this podcast is all about. As the founder of the Welcome to Humanity movement and True Voice Mastermind, Dr. Fred's work is centered on the power of communication to heal and connect people. He is the author of Creative 8, Healing Through Creativity and Self-Expression, and Find Your True Voice, and has written numerous articles for Psychology Today. Dr. Fred's most recent work includes the True Voice course, which helps people rediscover their voice and share their message with the world, and Healing the Healer, a virtual course and mastermind designed to support transitioning healers. Welcome to the Close the Chapter podcast, Dr. Fred.
Thank you so much. It's really great to be here. You're reading a little bit of an old intro, so I just want to get that right. My most recent work is more about the book that I just wrote. If we can, the book that I just wrote is called Welcome to Humanity. And Welcome to Humanity is my opus, and it's a memoir, a psychiatrist memoir and case against the mental health system. And that was just a labor of love. It took about 4 months of 16 hours a day, pretty much 7 days a week, just digging down to the truth of what's really here. How did Fred Moss even become a psychiatrist? Why did Fred Moss even become a psychiatrist? What has occurred in these 37 years as a psychiatrist and 46 years in the field itself? And where am I now with talking about psychiatry from sort of just on the other side of being in the belly of the beast for nearly 4 decades or even more than 4 decades and somehow surviving? I like to call myself a recovering psychiatrist. In fact, there's so much stuff going on in psychiatry that most people really do not have access to. And I've been looking and feeling into this for a long time. Like, I went into the field naturally because I hated the direction it was going. So I went into a field that I hated on purpose so that I could actually bring some modicum of what I knew to be true into a field that was already giving up on that. And that was the idea that human connection itself is at the heart of all healing, of all conditions, of all types everywhere. And although the roots of psychiatry going back into the early 20th century may have been built rhetorically on that notion, it clearly isn't the way things are going now at all. And when we really start looking at the wearing down of that, the deterioration of that, I saw that coming when, after dropping out of college for the second time, and presumably that was going to be the last time that I dropped out, I got a job at a state mental health facility for adolescent boys as a child care worker. And there, it was totally confirmed that for the first time ever, I had been searching for where and how can I communicate effectively and have it make a difference and maybe even be sustainable. And in that job as a childcare worker, all of those things were true. Now, I wasn't expecting to like that job. I was actually expecting to last at that job for exactly 3 weeks, because that's how long orientation went. And I felt like, yeah, I'll sit for orientation, get 3 large paychecks, at least large for me in that day and age, and buy myself a car and keep trucking, like go figure out what this whole life thing is about. But instead, I was convinced, or in some ways maneuvered or manipulated into going onto the floor on the 4th week. And it was there through terror, really. I was like, I don't know how to do this. I'm just me. What do I know? Coming in and realizing that communication and listening and being with people for who they are, like really getting who they are. Maybe there was nothing wrong with them. That's what I learned again, without a question, in 1980 when I started that job. And it was just like, okay, if I communicate with these so-called kids who are only 4, 5, 6 years younger than me in some cases, it seems to work to create like a burst of healing, a burst of even curing, a burst of pleasure, a burst of optimization, a burst of love or unification or reality or like assurance or reassurance or revitalization. All those things seem to take place naturally as long as I could be with another person. And look, that wasn't like revolutionary in its own right. That's what life is. Hello. Like I knew that when I was 2. I knew that probably before I was 2. I certainly remember knowing it at 2. And it hasn't changed. It hasn't changed for 66 years. It's still true. And we think we have other ideas about how this goes. What I liked about the job was being with the kids. I liked, went to afternoon shift and I had a great time being on afternoon shift because the admins were already home and we were kind of freewheeling. We could do what we needed to do and go on field trips and play basketball. And it was in the Detroit area, so there's things to do. But I just hated the way psychiatry was set. I just literally despised the direction that psychiatry was clearly going into. So as a visionary, it was like almost a hero's journey to come in and see how can I make a difference, like actually land in the beast and still somehow hold on to, but not even, I didn't know it was going to get like this. Let's face it. It's not like I had it going down this road exactly. But I knew that it was headed in a maladaptive direction. I could feel that because whenever something would happen on the unit, psychiatrist would be called and like if Timmy and Tony got into a fight, he'd come down with his clipboard or whatever and he'd talk to Tony and Tim for 4 seconds and then he'd talk to us for like 7 seconds and then he'd go in the nursing station and write something in a chart. We'd have to go retrieve both kids and then hold them down against their will while they're screaming, biting, scratching, kicking, spitting, all of that. And jam them full of some catatonic producing sedative hypnotic injection, which by the way, that's not back in the day. That's happened hundreds of times today already. Promise. That's not old news. That's the news. That's not like we grew out of that. We didn't. That's what's happening. That's what we do with people who get in, who do stuff that the staff or the diagnostician thinks is out of control. And then we come back the next day or 12 hours later, and if he's still in a stupor, then we say, doing well. We'd write, doing well, no side effects, sleeping night, breathing visible, whatever we say. And we call that okay. It's like, dude, that is so not okay. It is so not okay. So how can I go into the field? My brother was already a psychiatrist. He's never written a prescription for anybody. He's a psychoanalyst out of New York and who recently read my book, by the way, and deeply appreciated the book. So that was cool. That was like quite an arrival to have Don read my book and love it. I'm honored. It's like true arrival. Like I've been living my life to have Don read my effing book and tell me it's good. It's like, thank you.
Oh, I love that.
It's so true. But it was like, well, I guess I'll go back to school. I guess I'll find a way the third time through to get back there and complete my degree and go to medical school and get myself a psychiatric degree somehow, come hell or high water. And there was both hell and high water for certain. And before too long, I was a psychiatrist. And then I was a psychiatrist with the Child and Adolescent Fellowship. And then I had super large practice. I've seen 30,000 people in my life. I've been in every modality that psychiatry has to offer on the ground in Western medicine. I'm pretty sure I don't know a field where I haven't at least traveled, if not been a leader in the field for a time being. And lived all over the country. I've been a traveling doc, a teledoc. I've been in rehabs and homeless shelters and orphanages and inpatients, outpatients, nursing homes. And it's been an honor, but really what I've been looking for, where's the place I can stop and stay? So my resume is insane. Okay, it is. It's so ridiculous. I look at that resume, I'm like, wow, what a life I've had. And it's only been in searching for the place that I could stop my resume from becoming insane. I didn't want an insane resume. I wanted to find a place for which I could actually work from the core values that I hold about the idea that communication is at the center. And it's been a ride to be duplicitous. I've had to carry on sometimes doing things or writing things or saying things that I wasn't fully aligned with. And that's the level of pain and fracture that can create is massive. And so I lived duplicitously for quite a while before I just finally decided at some gradual or maybe semi-sudden level, maybe 2006 is the fulcrum, that I needed to realign myself, that I couldn't keep living both ways. I could not keep going to work and writing I didn't believe in. I could not keep pretending that what I was offering was going to be healing. I could not continue to lie, actually. knowing that there were ways that were way better than what was I being asked to give to help my clients actually find freedom or find love or find unity or self-respect or like forgiveness or acceptance or compassion. These are cool things. They really are. They've been cool things since the beginning of time. This is not an American thing. This is not a psychiatric thing. This is not Eastern medicine thing. This is not Lao Tzu. It's not. What this is cool things. Compassion, forgiveness, and acceptance are cool things to find. They just are for ourselves and others. We all know that. There's no one that doesn't know that. And so what if we injected those things when people felt bad instead of pathologizing them that something's wrong with them when they feel bad? We don't blame a log for burning in the fire, right? I mean, that's what a log does in a fire. That's just what a log does. You're not like, oh, bad log burned in a fire. Sick log burned in a fire. No, ill log. No, not at all. We're in a fire, Kristen. This is called life. It's been a fire forever. I'm not suggesting that this is the burningest fire of all time. Maybe it is, but let's put it this point. There's never been a time where the fire wasn't burning. That's for sure. It's been burning since the very beginning of time. And it's hard to be alive. It's hard to be a human. It is hard to juggle it all. What if we were just to approach all of these cases that we think have alphabet soup diagnoses and just treat them with the idea that, oh, look, another human bumbling, stumbling, fumbling, tumbling through trying to figure out how to be a human. We don't have an access to what normal is, that's for sure. Like if I ask you what's normal, you're not going to give me a reliable, universally accepted answer because there isn't one. And because there isn't one, it takes a tremendous amount of audacity to consider that we know what abnormal is. Compared to what? You don't even know what normal is. How can you say anything is abnormal? Like you got to have a benchmark to call something abnormal, not just outside your range of comfort as a diagnostician or hitting different check boxes in the criteria list of a DSM-4. That's not abnormal. That's just being human. And so when I learned that I could do that a little more reliably, I was really scared initially. I was scared that I was bucking a system that I didn't know how deep it went. I didn't know if I could look forward to character assassination or if there was something so insanely nefarious about the way mental health had been built that if you tell the truth, you get your knees chopped off. There is a piece of that, by the way, in the field for sure. Go to work in a prison and see if the truth is welcome. The truth is not welcome in the prison. The truth is not welcome in the prison. And the prison is not that far off from being an inpatient unit. So the truth is not that welcome in an inpatient unit either. Not that much better, if it's better at all. So the truth is really important to me. I don't know, maybe that makes me weird, but I'm really interested in the truth. I really am. And I don't know, I don't have a corner on the market of what the truth is. I'm just curious about the truth and I'm willing to upend my view of the truth if new information comes in, or at least I think I am. So how can we just treat people with compassion, acceptance, and forgiveness as a primary tool? Just another human, not like me, the provider, them, the client, but like two humans digging in oh yeah, welcome to humanity. That's right. Yep, I get that. Yeah, hell yeah, man. I don't like being distracted. I don't like feeling awkward. I don't like being terrified. I don't like being displaced. I don't like being hopeless. I don't like being aimless. I don't like being anxious. I don't like those things either. But that doesn't mean that there's something wrong with me. It just doesn't. It just doesn't. But if we start declaring that it does, which is what our present system is built on, because after all, in the first billing form of anyone that you see as an LMFT or as a social worker, as a psychologist, or as a clinician of any type, you have to have a diagnosis. You have to make a diagnosis. You just have to. There's no payment to a psychiatrist for a well child. You don't get paid. If you write, had no diagnosis, good. You have no payment. Okay, well, got to come up with something. So we come up with 309.28, think we're being kind to the patient. We think that's a benign diagnosis, benign as we can be. We'll just throw out 309. We all have adjustment disorder, so no problem. But what we don't realize is that's a psychiatric history the second we put that in there. It's a psychiatric history, and it's not going away. It's gum on the bottom of your shoe. It's here. It's for real. No one gives a hoot what diagnosis you put there. I mean, to some degree, if you put schizophrenia there, you get maybe a different impact. So the whole field is built on this cloudy castle made of sand. And it's not like to malign the people in the field. The people who went into the field were absolutely generally really heartfelt, felt they had something to offer, felt they really wanted to help people, had helped their brothers and sisters or friends in the past. They have some skill set in being able to listen and being able to care. And they've been programmed to believing that helping others is the highest form of being human. And they just want to be there. And they do that. Again, not minimizing any of that. Not far from that. Like, these are the people who enter the field. Super cool. Super cool. But those people go through whatever shift they go through inside of the educational process, both academically and, so formally in education and then out in the field or in the internships or whatever. And they get changed, and you start getting a new sense of what you're doing, who you really are. You think you went to school and now you know more about how to be a human than them? Really? You think you sat on a hard chair and watched a teacher say some stuff over and over again that you then repeated later in the week in front of them and got an A, and now you know more about humans? I'm not sure that that's a qualification to be more about humans. Maybe the real best way to learn more about humans is to look in at your own humanity and deliver that as somebody who can witness or resonate harmonically, connect overtly through conversation and communication with another human, sharing what you already know, not being afraid, not making it so, it doesn't even have to be unidirectional. We've been all taught, guard your stuff. It's really about them. Don't tell them about you, all that stuff. It's like, what is that even? What is the power gradient that gets created there? So we continue to ask those questions, right? And it stays hard for me. So after writing this book, the Welcome to Humanity book, which is my opus, it's truly went down into the holes. Version 215 is the one that got published, and it's good. It's a great book. Some of my friends have told me it's the best book they've ever read. And it's very rewarding. And I was able to really see, I can't get hired. I can't get hired in psychiatry right now with this attitude. What the F? What? I can't get hired because I speak like this? I could see them not wanting to hire me if I was interested in hurting people or something. But I'm so not interested in hurting anyone. And that is so permeating in how I am that no one will hire me.
So let's break this down, because for those that might not know, psychiatry is a doctor that prescribes psychotropic medication, correct?
Well, maybe. That's one of the things we do. That's what we went to school for 26 years to do.
Yeah. Okay. So what we're seeing is an uptick in medicine distribution, right? We know it's the highest it's ever been in history, giving people meds. Where do you feel like that falls in psychiatry, prescription medication versus, can we do both? Is there room for that, or what are your thoughts on that?
Oh, there's more than both. There's not only two ways to do this.
I love
Yeah. And so these are just the ways that get talked about, as if there's psychotherapy on one side and then medicine on the other side, and that those are the both. I assume that's the both you were referring to.
Well, what you were saying, I was talking about the both of what you were saying. Can we have this compassion and meet clients where they are, and if they need medicine, where's your stance on that?
I don't have it that they need medicine.
Yeah.
I don't have it.
Okay. So that's your you don't feel like people need any medicine if they have?
No, not on the front end. There's about 23 things we could do ahead of that would work way better, way more instantly with less pain and no such thing as side effects, no need for authorization, no need for even a doctor, that'll work way better and probably cure, literally put an end to the discomfort that you're in now, and maybe instantaneously. Medicines are not built for that. They are built to have you perpetuate the symptoms that the drugs were marketed to treat, so that you can come back next month and get your prescription and line up at Walmart or Walgreens or CVS every month and get your 60 or 90 pills that you wouldn't want to miss any and be a bad client. No, it's not the best way in any situation. Now, it's never my first line treatment at all. Not at all. Now, there's people who come in, they're already taking medicine. They have no interest in coming off of medicine. They think that it's helping, and, they're pretty sure that this is the best thing since sliced bread, and they appreciate their doctor and appreciate their diagnosis and appreciate their medicines and their treatment plan. And for those people, more power to you. No problem. This conversation isn't really for you. It's okay. It's more than okay. It's completely okay that you're interested in that. And in fact, If you've reached a point where you don't even want to consider an upgrade, even if there was one, well, congratulations. Like, you need to bottle that one. If you're at such a high point that you're so happy with how you've been treated that you wouldn't want to trade it for the world, I'm not kidding. It's okay. I'm literally envious. I'm literally admiring. It's very cool. But there are hundreds of millions of people who have been mistreated or undertreated or overtreated or misdiagnosed or underdiagnosed or overdiagnosed. Hundreds of millions of people who know what the hell I'm talking about. They do. They do. Because I'm not saying anything so crazy.
No. So when you say there's 23 other things someone can do besides medicine first, what would those things be for those who are like,
well, it's not like,
no.
Listen to the person, resonate with the person. That is your number one thing.
Well, let's say the person is just listening, not a therapist or anybody else. Let's say this is most of my people are just, they're on a journey of
you don't need a degree to do this. There's no specialty, and nothing in school taught me this. Nothing.
But they
Humanity
when you
taught me
say
this.
Listen, they have to find someone to listen to them, right? Is that what you're saying? Like, some people feel like they don't have someone to listen to them.
I'm sure they do, because no one's actually listening.
Yeah.
It's true.
Yeah. So people need to listen more. They need to listen.
In the world of listening and resonating harmonically, in the world of connection, in the world of communication, when someone finally feels heard for what they're saying and who they are and who they're not, there is a gargantuan healing that takes place at that second that no medicine has ever provided to anybody. It's just so much more profound. It's so much more profound than any kind of diagnostic ICD-9 code, and certainly any kind of milligrams of something that you swallow or put on your skin or put in your arm or whatever you do. And so that's number one. And then there are many practices that we can do. For instance, meditation is a very powerful practice. It's been around, I don't know, I think since the beginning of time. Pretty sure Adam meditated. I'm not positive, but I think he might. It seems like he might have. And then there's gratitude, like actually waking up and putting stuff into your life, like reminding yourself that it's not nearly as horrible as you're about to think that it is. Or maybe it is, but that you can actually hold that, like in gratitude or nutrition or hydration or creativity or nature or pets or journaling or reading or writing or pampering yourself or spirituality or service. There you go. There's about 15 there. I could certainly find some more. And that's part of the Boss Method, by the way, a group of 20 things that I compiled. I made up none of them. They're all age-old, timeless, and proven. And they're just like what works for humanity, what really works. So this idea of I need medicine, it just makes me cringe all the time. It's like, no, you actually don't. You don't need something made in some high-rise skyscraper in the middle of some downtown city that is actually making you worse at the same time that it's seemingly making you better. Like, it's actually perpetuating your symptoms. It doesn't even pretend to cure. None of these medicines ever say they cure because they cause. That's why they cause. So why would they suggest that they cure? They want you to know that you have a condition now. You're actually saddled with that for the rest of your life. You may have a propensity for a relapse and all that. And that's good in some ways. Good, really good for the system. My last job in March, I got fired because my retention rate went below a certain number. So they wanted me to like retain 70% of my clients. And I was like in the 50s. And they just fired me outright. I'm like, bro, my patients get better and I tell them to go away. How can I possibly get penalized for that? And they fired me. And there's a lot of places where that's the metric. Yeah. The metric that matters is how well can you keep someone thinking they're sick enough to come see you again. And maybe they're not sick. Maybe it's just like a log is in a fire. And I'm left with really looking at, well, how do I want to live my life? What about this duplicity? If I'm going to be shot down for this level of what I think is loving honesty for what it really means to be a human, I don't know about you, but I've had several moments already this morning that have been freaking miserable, like crazy miserable. That's just part of being human at this point. Let's just be square about it. And when we're square about it, we don't have to pretend that by thinking that we are clinicians, that we got something they don't. After all, we got these diplomas and we got this nice house and we got like a couple kids and maybe a partner and we got to pay our bills and we look good and all that. And we went to this school, like we went to, after all, we went to that school, like that's where we did it. And we then think that we have something our clients don't have. Maybe that's not even true. And that paradigm can be lost, and you can actually create a system where people feel appreciated and seen for their own humanity rather than confirm that there's something wrong with them. Now, here's the thing. People come to the mental health worker. It's the only subspecialty in all of medicine and maybe all of the healing arts. Whereas if you tell somebody that they're okay, they get pissed. Wow. Because there's some real secondary gain available in hearing that you're not okay. Look, I feel miserable and I don't want responsibility for the parts of my life that aren't working out the way I want them to. So can you tell me which alphabet soup diagnosis I have? Because I clearly got one. Yeah, ADHD. Yeah, maybe MDD. Yeah, BAD. Sure. You're on the spectrum. Yeah, you got schizoaffective disorder. Yeah, you got schizophrenia. Yeah. Cool. In some ways, and then the minute I give you that, the minute I wield that tool called diagnostician, it's a ridiculous tool. The minute I wield that, you get some sort of comfort because now you can say stuff like, "What? That wasn't me. That was my bipolar. That wasn't me. That was my social anxiety. That wasn't me. That's my ADHD. That wasn't me. I got PTSD, chronic." You carry on the new diagnosis and that becomes you. And then you walk out of the office, maybe not you, but you get my point. The patient walks out of the office and says stuff like, "Yay, I found out. At least I found out what I have." And then you go to the next office the next week, like someone else has to see you. And they'll likely come up with a different set of alphabet soup because the diagnoses are not built in truth. They're built into representation of the mind of the diagnostician only. No one's running through and checking off boxes, and that freaking DSM-4 is a piece of junk anyways. It's just silly. Everyone meets a criteria, and when you get a criteria, you get like a fly in a spider's web. You're caught up in the system. As soon as you decide, hey, I think I'm going to find out what's wrong with me. I'm not going to find out if something's wrong with me. I'm already sure that there is. Now I'm going to go find out what it is. And then in order to be a good patient or continue to pay respect for my deficiency, I'm going to keep seeing my clinician over and over and over and over and over again, as long as I want to be a good patient. I don't want to be called non-compliant. I don't want to be like a bad patient, or my family might think if I'm not taking meds, I don't care about them or something like that. When in fact, all you really are, for real, you're just another human. I promise. You're just another human. Unless you're not. If you're a bot and you're listening to this, that's a different game.
Yeah. So when people come in and they feel like, I don't feel right, I don't feel good about myself, I feel shame, but I feel like there's something, I don't know, I don't feel good about myself.
Yeah.
Okay. Which a lot of people come in with that, right?
Yeah.
And I really resonate when you say it kind of becomes their identity. I hate diagnosing. LMFTs aren't really supposed to be diagnosing. However, we have to put a diagnosis in the chart,
Yes,
right?
you do. Yeah.
Which is silly to me. Always has felt like that's
Well, it's not. It's more than silly. It's a little bit dangerous. It's beyond silly.
I mean, we don't bill insurance, and also it's still in the chart, right?
You
Still in the
confirmed it.
chart.
You confirmed it.
yeah.
You said it.
Yeah, still in the chart. So for me, when a client comes in, that's what I do. I meet them where they are. I am holding empathic witness to what they're bringing in. And then they go to a psychiatrist. I'm not saying all psychiatrists, in general. And then they get these, "Oh, you need a benzo." And I'm like, "What? Why are we giving this client a benzo? Like a Klonopin, or something like that." And I find it just stunts the work we're doing because it's severing their connection to their bodies and to their emotions that are imperative to really healing. Why do you think we're just throwing these medicines at folks?
Well, throwing the medicines is not the problem. The folks, just because I throw a medicine to you doesn't mean you have to take it. So let's
They
face
feel
that.
relief. They feel relief like, "Oh,
Well,
good. Now I have
I know that, but if we start really looking at where this cascade really starts, in 2006, which I mentioned, there was a paradigm shift that took place in my life. And we start really realizing that, like, I started taking people off of medicine. And I had a choice group of people. I had a very large practice in Cincinnati, Ohio. And I started taking choice people off their medicine because I felt that they could do better than they were doing. They would come in every 3 months with a little tremor and they'd say they're all right, or, yeah, I'm not too bad. I'm making it through the day. And then the typical doctor would write like patient unchanged, no side effects, come and see him in 3 months. They'd just say that would be good enough. Well, I decided that it wasn't good enough and I started taking people off meds. And sure, lo and behold, there was this profound and very real, reliably predictable improvement in who they were as people as soon as they came off their meds. Like that would just happen over and over and over and over again, such that the diagnosis they thought they had actually disappeared. Like it would be like, okay, this is really interesting. These medicines are not only not doing what they say, they're actually, in many cases, perpetuating or causing the symptoms they're marketed to treat. So I started looking at, well, where is it? It's not the medicine. Those little things are benign. They're just things. They're like jam or something. You put it in your mouth, that's when it starts being a problem. But it's not the patient either. It's not the patient who's putting in their medicine. So that's not the problem. It's not the doctors, because they're only doing what they're taught. Like, what's the entryway to the sequence? And the entryway to the sequence is thinking there's something wrong with you and then wanting to get that confirmed. That's the entryway to the sequence. Because if that doesn't happen, we can stop the cascade. But once that happens, you're on a hamster wheel that you can't really get off. And once that happens, and once a doctor, again, or a clinician or whoever the professional is, has the audacity to agree with you or to give you something that is confirmatory that there's something wrong with you, then everything changes that instant. For instance, if you come into my office and you're like, Dr. Fred, I don't like my skin. It's too gray. It's mottled. I have a really big nose. I'm kind of too heavy. I drink too much water. I eat too much peanuts. And I'm a mess in a china shop. And I'm like, okay, let me take a look at what your diagnosis is. And I go through my DSM-17 and I'm like rolling through. I'm like, okay, I think I found it. You're like, oh, good. What is it? You're an elephant. It's like, oh, man. That's so cool. I had never heard anybody say that, but you're right. I'm an elephant. Now, when I walk out of the office, really so happy because the doctor was kind. He was smart. He actually listened. He looked me up. He found me in a book. He gave me my diagnosis. He told me what to do. We're all good. I walk out of the office. I'm looking for circuses and chains right away because I'm now aligned with being an elephant. And I spend my life thinking that I now belong with circuses and chains because that's what elephants do. And so an identity gets built there that can be very quiet, very subtle, but very, very real. There's another metaphor I like to use, and that is, let's say you had like a mosquito bite on your elbow, okay? And you're like, it's really gnawing at you, and it's just like hard to think of anything else, and you want to scratch it, and it gets bigger and in your way of sleeping. And you call me and you're like, I have this mosquito bite on my elbow. Do you know anything that can help? And I'm like, yeah, I do. Actually, there's a specialist that lives right near you and it's got a 100% cure rate and you should go see him because it's a 100% cure rate. So you go and you see him and knock on his door. He answers the door with a stethoscope and his name embroidered and he's got art in the corners and his diplomas and a sliding glass window and a computer and a pretty receptionist. And he's got a couch in his office and all those things which have nothing to do with healing, by the way, none of them, not even one of them. But you know what I'm talking about. That's a doctor's office. That's what a doctor's office is. And you walk into his office and he takes out his pen and paper and you tell him, yeah, Dr. Fred sent me here. He said, you're the mosquito bite elbow specialist. Yeah, that's me. 100% cure rate. Yeah. Okay, I'm in the right place. Let's go. And he pulls out his magnifying glass and looks at your elbow through half glasses. He's like, okay, well, you got a mosquito bite on your elbow. You're like, yeah, I know. That's why I'm here. And so let's go. He's like, okay, cool. Well, I do have a 100% cure rate. It's only going to hurt for a minute. He says that famous doctor line. And you're like, okay, I can handle a minute. Other people have come here. Let's go. And he takes out a saw and cuts off your arm at the shoulder. And he sees there's no more mosquito bite on your elbow. And he lets you know that there's no more mosquito bite. If you stay myopic enough, you're really happy with that cure. At least you don't have a mosquito bite on your elbow anymore. Now, when you come back in 2 weeks, you're not going to have a mosquito bite on your elbow either. It's a 100% cure rate. It's just look what you lost in the process if you weren't watching what's going on there when you take on that diagnosis or take on all the things that the medicine does to you, not just the idea that the mosquito bite is gone. What he did had nothing to do with the mosquito bite. Do you get that? No part of that intervention looked at the physiology of a mosquito bite. But your mosquito bite is rightfully gone. And if you stay focused with that and forget all the things that have happened in the meantime while you took on that diagnosis and that treatment plan, then you might be happy with the treatment. But you were blinded by the idea that you lost so much in that process. And most of the 20 things that I'm talking about, in fact, for sure, all 20 things that we're talking about in the Moss method and also the other things that we had said, listening and being connected, none of those have anything like that associated with it. And thinking that there's something wrong with you, like really getting, oh, no, I don't feel right. No, I got to tell you, I'm not feeling normal. There's something wrong with me. That is a foundational component of being a human. That's actually a sign that you're normal. The fact that you think there's something wrong with you is a key component of being normal. It's okay. Welcome to humanity falls in. Like, none of us think there's not something wrong with us. You can't like literally walk through the world and say, no, actually there's nothing wrong with me. In your darkest moments, for sure, and in times when you're alone, you're pretty positive that there's something fundamentally wrong with you, because that's human. That's not sick. That's human to have that thought process rotating in the background. When we look at all three of those truths together, the elephant and then the mosquito bite and this idea of not thinking there's something wrong with you, or thinking that there's something wrong with you being fundamentally human, then we have the makings of an entirely new way to be helpful with another person. And that is to connect with them for real, no matter what they're saying. Let's say they say something about that topic, pisses you off or makes you think they must be an idiot, because these days we've been taught about those, right? There's some topics out there that if this person actually says that, I can't even believe anything else they say about their life. The minute they say that, they're canceled. If they say, I like this, or I agree with that, or I believe that, and it falls against the way you think about that particular topic, there's a very good chance that you will cancel them off of your list as being even pertinent humans. We have reached a funny time in life that has somehow created a situation that not connecting with someone who's in diametrically opposed to you in a particular topic is the better way to handle it, rather than actually finding a way to connect with that person too. Like, that's possible. It's a little idealistic. I get it. I have it too. I'm just human. I judge and evaluate and assess. And if you said that thing right now, that there's a couple of those things, if you said, I'd be like, oh, well, I thought you were cool until you said that. Mm-hmm. And then that could happen. Mm-hmm. And now I don't think you're cool. Everything about you is cool, except you said that. Now that blankets everything. We've reached a funny stage in life where diagnosing and pathologizing and then taking on our own pathology and becoming our pathology and then even leading with it. Like, if I ask people, I don't know how often it's happened to you, but probably pretty often in LMFT status, which is people walk in and if you ask them what's up, they say, yeah, I was diagnosed with schizoaffective disorder last year. Like, that's the first thing that come out of their mouth. I had generalized anxiety disorder. I got PTSD. I got chronic PTSD. I hang out with a narcissist. I am a narcissist. I have borderline personality disorder, major depression, but type 2. And it's like blah, 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 blah. And it's like, okay, let's find out what's really going on there. I don't give a hoot about what alphabet soup you received from anybody. I get it. They meant good intentions. It's just not who you are. I'm going to see who you are.
And we're almost out of time. I have one last question. What do you say to people that they try a lot of the suggestions? They're journaling, they're walking, they're playing with their dog, they're meditating, they're etc. Reading the books, and they still feel like they can't access, like there's no relief. They still don't feel better. They still don't feel good. They still feel like they're trudging through life. And one of
the things to do is look at why is that their choice to be that way? They actually have a choice given every single second. Every person has a choice to look at the world in the way that they look at the world. The data out there doesn't have to change. There is some secondary gain in taking on what people do, in taking on diagnoses. The lower on the ladder you choose to stay, the less far it is if you fall. So people don't want to pursue their lives because falling from something that's really working, that comes at risk, something that could work, comes at risk. So one thing to say is, here's the thing. You do 20 of those things, you get a life that works. By the way, you do those things, you're not going to do 20 of those things and not get a life that works. If you're detoxing, if you're actually drinking lots of water, if you're eating lots of good food, if you're gratitude, if you're hanging out with pets, if you're getting out in nature, if you're reading, if you're journaling, if you're spiritual, if you're service, if you're pampering yourself, if you're listening to others, if you're being creative, if you're meditating, if you're showing gratitude, your life is going to work way better than it's presently working, no matter where you are on the spectrum right now. Now, if you do all those things and you then still choose to say, I'm miserable, you got to ask yourself what's going on that has that be the dominant feature, the dominant choice of how you describe yourself. That's all. We're all miserable. Are there 100 reasons to be miserable? How long would it take me and you to come up with 100 reasons to be miserable?
1 second.
Like 4 minutes, probably. If you have to write them down and we took a break halfway through, it'd be like 4 minutes. How about to be really terrified? I don't know, about the same amount of time. How about to be really distracted? Oh yeah, how about that? How about to be really awkward? How about to be like discombobulated? How about to be hopeless? How about to be aimless? You get to shaking your head. Yes, like, yeah, I could do that. I could do
Easy.
that.
I mean, we all could.
So what's the deal? We pay so much honor to our negative experiences that we're willing to call that who we are. There's some value to that, to taking on like a default skepticism that is part of being human too. So we can relate to it, but we can also see that you've been released. If you would like, you don't have to feel miserable as a primary way of looking at the world. It's truly possible, as shown by when you played music or when you bathed or when you went out to a walk with your dog, or like you were released and then you chose to go back to where you were but after you came home. That's really possible. We think that we're at the mercy of our habits, the things that brought us to here. Well, I'm miserable because I got major depression. So just what happens to me? As if we're not the author and sovereign master of our own life. We really are on those tricky points. And any given second, could I be miserable right now? There's a background right this minute. If I get out this call, I could cry my eyes out in a flipping second. I really could. There's plenty of ways to be miserable. But if I don't want to be miserable, there's other choices as well. That's what I say.
Yeah, this could be a deeper conversation. I could keep going. Where can people find you if they're interested in learning more? They're like, I want to find more about Dr. Fred.
All right. So the best place to find me is my book, for sure. My book is everything about me. When you read that book, you will know me better than I know me. And so that's welcometohumanitybook.com. And that's probably the best place. And then I hang out on LinkedIn, and I like that over there a little bit. I hate Facebook, but I sometimes trickle into there. And then I have 2 websites, whoisdrfred.com, and I have another one called welcometohumanity.net. And speaking to all of that, I have a link called welcometohumanity.net/podcast. And that's where my podcast listeners get sort of set off into a particular direction.
I love it. We'll link all that in the show notes. Dr. Fred Moss, thank you for being with us today. I appreciate you and can't wait for everyone to hear the podcast and hear what they have to think.
Thank you. It was really fun. Appreciate it.
Thank you so much.
Thank you so much for listening to the Close the Chapter podcast. My hope is that you took home some actionable steps along with motivation, inspiration, and hope for making sustainable change in your life. If you enjoyed this episode, click the subscribe button to be sure to get the updated episodes every week and share with a friend or a family member. For more information about how to get connected, visit Kristen, KRISTEN, Boyce, BOICE.com. Thanks and have a great day.